It's now my honor and pleasure to introduce our speaker, Dr. Caldwell Esselstyn. Dr. Esselstyn is attending live today on Zoom from Ohio, where he is currently a consultant at the Cleveland Clinic Center for Wellness and Preventative Medicine. Dr. Esselstyn has led an amazingly rich and diverse life, which is a testament to a life lived with passion and compassion for others. He's really been an inspiration to me, and I'm sure for many of us here. Caldwell Esselstyn received his Bachelor of Arts from Yale University in 1956 and his MD from Western Reserve University School of Medicine in 1961. In 1956, he received a gold medal in rowing at the Olympic Games. In 1968, as an Army surgeon in Vietnam, he was awarded the Bronze Star. He trained as a surgeon at Cleveland Clinic, and he has been associated with Cleveland Clinic since 1961. He was president of the staff and a member of the Board of Governors. He became the first recipient of the Benjamin Spock Award for Compassion in Medicine. He received the Distinguished Alumnus Award from the Cleveland Clinic Alumni Association in 2009. In 2013, he received Yale University's George Herbert Walker Bush Award for Lifetime Achievement. In 2016, he received the Case Western Reserve Medical School Distinguished Alumni Award. And also in 2016, the American College of Lifestyle Medicine awarded him their Lifetime Achievement Award. He has over 150 scientific publications, and his pioneering research is summarized in his best-selling book, Prevent and Reverse Heart Disease. In July of 2014, his study of 200 patients confirmed an even larger group can be adherent to a plant-based diet and achieve the same significant arrest and reversal of heart disease. Since then, his work has spread the message about the powerfully positive impact a plant-based diet has on cardiovascular health, and as a result, many cardiologists now eat a whole food plant-based diet and recommend it for their patients. The title of the talk today will be Vanquishing Heart Disease, so please join me in giving a very warm welcome to Dr. Caldwell Esselstyn.
Dr. Fior, Dr. Esselstyn, I wanted to say thank you for those kind words. And I can't tell you what an honor it is to share my thoughts with the group of science and technology and spirituality. Now, the thing that is really rather exciting about this whole business is the fact that we've known for many years that there were multiple cultures on the planet Earth where cardiovascular disease is virtually non-existent. The rural China, the Tarahumara Indians in northern Mexico, Central Africa, the Papua Highlands in New Guinea and Okinawa, heart disease practically unheard of. And now this is the oldest slide in my presentation. This I took in 1968 when I was leaving Vietnam, having served a year there as a combat surgeon. And this slide is to remind me to share with the audience the fact that when we autopsied our GIs who had died of combat in 1951 during the Korean conflict, it was really quite striking to notice that in these average 20-year-olds, there was already gross evidence in 80% of these GIs. There was gross evidence on autopsy of cardiovascular disease. Not enough for their cardiac events yet, but there in these young men already was the establishment of early heart disease. Now that study was then repeated, actually 45 years later, this time looking at young women and men between the ages of 17 and 34 who had died of accidents, homicides, and suicides. And now early coronary artery disease is ubiquitous in everybody. Now, here's when we had a chance to really get it right. In World War II, when the Axis powers of Germany would overrun the Low Countries of Holland and Belgium, characteristically, the Germans would take away their livestock for their troops. So in these Western countries, there was an absence. They've taken away their cattle, their goats, their sheep, their pigs, their chickens, their turkeys, gone. Suddenly now these Western European nations during World War II were thriving on whole food, plant-based nutrition. And it was interesting that in 1951, Doctors Strom and Janssen, reporting in England's leading medical journal, The Lancet, began to look at Norway, looking at Norway for the number of heart attacks and deaths from stroke and heart attack during this time period. Now, if you will share with me, together, let's look at this slide, starting on the left, and you can see deaths from heart attack and stroke in Norway in 1927 were going up. In 1930, they were going up. 1935, going up. 1939, in come the Germans. Down goes the deaths from heart attack and stroke. Who knew these Germans were these great public health educators? But look what happened in 1945. With the death of Adolf Hitler, the cessation of hostilities in the European theater, back comes the meat, back comes the dairy, back come the heart attacks and the strokes. Now here we have an interesting couple of images. On the right, you will see an artery that obviously you're probably saying to yourself, that's pretty severely diseased. And when that small opening closes off, there's going to be a heart attack. Well, actually, only about 10% of heart attacks occur from something this nasty, but we're going to find out in just a few minutes how 90% occur. Now, on the left, this is a normal artery. I want you to notice that even those of you in the back of the room can see that innermost lining is a little tiny dark lining to that artery of specialized cells that we call endothelial cells. And we're going to hear more about those subsequently, but I wanted you to know where they are. Now, the trouble with eating the Western diet, which has got many molecules that become oxidized, and that leads to a lot of stickiness in the flowing of blood. We're going to see this slide again in a moment or two, but right now, this is a slide I want you to recognize from Peter Libby from Harvard. And the blue area is where the blood is flowing. And once again, if we work together and take our attention to the upper left of this slide, you will see those small orange molecules of LDL cholesterol. Now, when they become oxidized by the foods that the Western diet that we eat, they migrate towards the lining of the artery. As you can see here, where the blue is meeting the artery, there's one single layer of cells we call, again, the endothelial cells. And those oxidized orange LDL molecules migrate, find a fissure or a crack or an opening, and get into the subendothelial space where they are no longer, on the left again, they're no longer being painted orange by Peter Libby. They're now yellow to indicate they are a small, hard, dense, oxidized LDL particle. Now, the subendothelial space does not like those oxidized LDL molecules and calls upon our SWAT team, which here on the slide you can see are the blue macrophages that come from the flowing blood, also find an opening or a fissure or a crack through the endothelial cells and get into the subendothelial space where they try to mop up, going from left to right, they try to mop up all of these small, hard, dense LDL cholesterol molecules until we get all the way over to the right on this slide, when those macrophages are absolutely chock full. We in medicine do as we do so often, we change the name. It's now called a foam cell. And what is nasty about the foam cell manufactures these nasty molecules we call metalloproteinases, stromelsin, elastase, collagenase, and myeloperoxidase. What do they do that's so bad? Well, they progressively erode the cap over the plaque. So let's do this. Look at the image on the left here. You will see there is a plaque. And at the uppermost border of the plaque, you can see there's a little tiny crack that's developed. That's occurred because those metalloproteinases from the foam cell have progressively thinned out the cap over the plaque. So it gets so thin, especially at the upper area, the sheer force of blood racing over that thinned out cap over the plaque tears it. And now what you have is the extravasation, or the oozing out of, if you will, of plaque content into the flowing blood, which activates our platelets, which are our clotting factors. So now we go to the middle image, and you can see the area where the cap has ruptured. A clot is forming, and the clot is in and of itself self-propagating. So in a matter of further minutes, we now go over to the image on the right, where the clot is so large, it is completely occluding. It is completely blocking any flow of blood past that point, so that all the downstream heart muscle now suddenly is deprived of all nutrient and oxygen, and it starts to die. And that, ladies and gentlemen, is 90% of heart attacks. Now, if I do my job correctly today, hopefully all of you and your friends and relatives can make themselves heart attack proof. How are we going to do that? We're going to do that by changing your biochemistry. How do we change your biochemistry? By changing your food. When you're changing your food to plant-based nutrition, that entire sequence of steps that we have just gone through together is eliminated. You don't have the oxidation of the LDL cholesterol. There is no migration of the bad cholesterol into the subendothelial space. There is no appearance of the macrophage that eventually develops into the foam cell. There's no foam cell. There's no metalloproteinases to thin out the cap over the plaque. And when you make it so that you cannot thin out the cap over your plaque, but you actually strengthen the cap over your plaque. When you strengthen the cap over your plaque, it cannot rupture. And when you cannot rupture the cap over your plaque, you have made yourself heart attack proof. And we think you can have that happen in as readily as 3 weeks. Pretty exciting stuff. All right. You can forget the x-ray in this slide, but I want you to focus on the artery where the artist has showed us that half of the artery opening is filled with plaque and the other is still open. If you look at the open portion, you will see that it is lined with those wonderful endothelial cells that we've talked about. Now, we used to think up until about 1980 that the endothelial cell was merely these nice, cute little red bricks that were lining our wonderful vascular pipes, if you will. That all changed in 1980 when Dr. Furchtgott, working in Brooklyn in his lab, was taking the largest blood vessel, the aorta, from a rodent, and he would do this sort of elliptical spiral staircase cut on it. And then he would immerse it in a bath of saline and it would constrict. But one day, no cut on the aorta. He immersed it, and of all things, it dilated. He did it again with an aorta, no cut, dilated again. Now suddenly, now globally, the race was on. What was the EDRF molecule that Dr. Furchtgott had discovered? Endothelial-derived relaxation factor. Fortunately, that term was with us for only 8 years, because in 1988, 3 scientists Dr. Furchtgott, Luignaro, and Murad discovered that the EDRF was indeed a molecule of gas, nitric oxide, for which those three men, 10 years later in 1998, received the Nobel Prize. Now, what is it about nitric oxide that makes it worthy of a Nobel Prize? Well, we have to look at its functions. For example, nitric oxide will keep all the cellular elements within our bloodstream flowing smoothly like Teflon rather than Velcro. It keeps things from getting sticky. Number two, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate. That's nitric oxide. Number three, nitric oxide will protect the wall of the artery from becoming thickened, stiff, or inflamed, and protect us from getting high blood pressure or hypertension. Number four is the absolute key. A safe and normal amount of nitric oxide will protect us all from ever developing blockages or plaque. So literally, everybody on the planet Earth who has cardiovascular disease has their disease because in the previous decades, they have so sufficiently trashed, injured, compromised, and turned their endothelial system into an absolute train wreck. They no longer have enough nitric oxide to protect themselves from making blockages and plaque. However, the good news is this. This is not a malignancy. It is a completely benign foodborne illness. And once you can get patients to understand that never, ever again are they to pass through their lips a single morsel that is going to further injure an already train-wrecked endothelium, then the endothelium will recover, make enough nitric oxide so we can halt any disease progression, and we often see elements of disease reversal. Now, it's about at this point in my presentation, if I look out at the audience, I see people saying to themselves, golly gee whiz, I wonder how much nitric oxide I have got. Well, we really don't have a good test in the doctor's office to examine that yet. However, how it's done in research, I want to just share with you. In research, what you do is you take an ultrasound probe and you place it over the brachial artery at the elbow, and there you measure the diameter of the brachial artery. Then you encircle the upper arm with a blood pressure cuff that you inflate beyond systolic blood pressure so that for 5 minutes, there's absolutely zero blood flow to your forearm and hand. And I've had that done, and it's not exactly habit forming. But then after 5 minutes, you release the cuff and then take the ultrasound probe and immediately remeasure the new diameter of the brachial artery. And in the normal individual, it'll be 30% greater because of the outpouring of nitric oxide during the time that that tourniquet was in place. Now, the other thing that's important to discuss was a finding of Dr. Robert Vogel, who was chairman of cardiology at the University of Maryland. And he took a group of healthy young subjects to a certain fast food restaurant characterized by arches, which are golden. Half of the group had cornflakes, and then they had the brachial artery tourniquet test for nitric oxide, and it was normal. The other half of the group had hash browns and sausage. And after 120 minutes with the brachial artery tourniquet test, they could not dilate the artery. That single meal had so trashed, so injured, so compromised that the endothelial cell could not really produce enough nitric oxide to dilate the artery. However, as they were followed into the late afternoon and early evening, they began to recover. However, you and I know that the next The morning for breakfast, it'll probably be scrambled eggs and bacon. Lunchtime, it'll be white bread with mayonnaise and cold cuts. Supper time, it'll be a baked potato with sour cream, lamb chops, vegetables soaked in butter, ranch dressing on the salad, ice cream for dessert. Here in the good old USA, we start with our children, giving them foods that is going to compromise and injure progressively their endothelial production of nitric oxide. So, summarizing, nitric oxide's functions: prevents stickiness, very important, one of the strongest blood vessel dilators in the body. It prevents arterial thickening. It prevents blockages, prevents smooth muscle migration into the plaque, and will destroy Darth Vader, the foam cell. Now, what you see on this slide are 4 marvelous defense mechanisms that we have in our body. And we only have time today really to talk about the endothelial cells, but I want you to know that for all of these defense mechanisms, they're markedly optimized with whole food, plant-based nutrition. Well, now here's where the rubber meets the road. What's it like when you do a study? So this is the first study. This is a small study that I did in 1985. These are patients who had triple vessel coronary artery disease, 23 men, 1 woman. That's nothing against women. That's simply the way the patients were sent to me when we started this study. And they ranged in age from 44 to 68, and they all had severe triple vessel coronary artery disease. So I wanted to take them and see if they couldn't eat in a way that we would protect their endothelial cells. So we avoided all the foods that injure endothelial cells: oil, olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil. Also, oil in a salad dressing. We wanted to eliminate the oil. We wanted to eliminate also anything that had to do with meat or animal studies. Meat, fish, chicken, fowl, turkey, and eggs. Also, we wanted to eliminate dairy. That was milk, cream, butter, cheese, ice cream, and yogurt. We also eliminated peanuts, peanut butter, nut butters, cashew sauce, and avocado, and coffee with caffeine. Now, for those of you who are just a little bit nervous or puzzled about the getting rid of the oil, here, for example, is a peer-reviewed scientific article showing the downside of oil. Olive, soybean, and palm oil intake have a similar acute detrimental effect over the endothelial function in healthy young subjects. Taking a little bit of a turn now for a moment, I wanted to just share with you a study done by Stanley Hazen at the Cleveland Clinic Department of Cardiology. And what Stanley did was he looked at people who were omnivores, that is, who eat the foods that you see listed up here. When people eat these animal food products, he found that they have in their microbiome, these omnivores have in their microbiome, in their intestinal tract, they possess bacteria that when they metabolize lecithin and carnitine, the molecules that are found in these animal products, the end result is trimethylamine, which is rapidly oxidized in your liver to trimethylamine oxide. And he found that trimethylamine oxide was deleterious and injured the blood vessel. Here is a schematic. Lecithin and carnitine gets exposed to the gut bacteria of the omnivore. The result, trimethylamine oxide, which then promotes vascular disease. I'm going to take you away from cardiovascular disease for one slide. And the reason I do it is this was a very momentous time for the World Health Organization. When think about it, almost everybody around the world, part of the World Health Organization, agreed that the consumption of red and processed meat had the same level of carcinogenicity, the ability to make cancer, as did smoking cigarettes. All right, back to our study. What were they eating? All these marvelous whole grains for their cereal, bread, pasta, rolls, and bagels, 101 types of legumes, lentils, and beans, all those marvelous red, yellow, and green leafy vegetables, and some fruit. Now, I did make a really major change in 19, let's see, it was about 10 years ago, I made a major change in the program, which included a awareness of the importance of nitric oxide. For example, you never heard of a boy or a girl at age 8 having a heart attack, right? No, they have nitric oxide pouring out of their ears, but by the time they're beautifully healthy at age 50, they now have 50% of the nitric oxide they had when they were age 25. And by the time they're 80, they've lost 70%. So the changes I made were two. One was a greater stimulation of the endothelial production of nitric oxide. And number two, we embraced the newer research that shows us that mankind has an alternate pathway for making additional nitric oxide. So here we go. I need those patients with heart disease to consume 6 times a day. I want them to chew a green leafy vegetable, roughly the size of 1/3 of a cup after it's first been steamed or boiled, 5.5 to 6 minutes so it's nice and tender. Then they must anoint it with several drops of a delightful either balsamic or rice vinegar. Why? Because research has shown us that the acetic acid in those vinegars can restore the nitric oxide synthase enzyme, which is found within the endothelial cell and responsible for making nitric oxide. So you're going to chew this alongside their breakfast cereal, again as a mid-morning snack, again with your luncheon sandwich. That's 3. Mid-afternoon, 4, dinner time, 5, and of course I adore it when they have that evening snack of arugula or kale. The second benefit from chewing the green leafy vegetable, you restore the endothelial progenitor cell, which will replace our senescent, injured, worn out endothelial cells. The third benefit, when you're chewing a green leafy vegetable, you are chewing a green nitrate. As you chew the green nitrate, it is going to mix with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Those bacteria are going to reduce the nitrate you've been chewing to nitrite. And when you swallow the nitrite, it is your own gastric acid which will reduce the nitrite to more nitric oxide, which can enter your nitric oxide pool. So think about it. What you're doing for minimal expense, no side effects, all day long, dawn to dusk, morning to night. You are absolutely producing nitric oxide, that wonderful molecule, the very deficiency of which has given you this disease in the first place. Now, there's a caveat to this. Toothpaste with fluoride, public drinking with fluoride, and mouthwash will injure the beneficial bacteria in your mouth. And I do not like antacids because antacids will decrease your gastric acidity and you will be unable to reduce the nitrite to more nitric oxide. The top 6 would be kale, Swiss chard, spinach, arugula, beet greens, and beets. No oil. with apology to Leonardo da Vinci. So going back to our original study, over the 5 and 12 years, as you can see, the cholesterol was under 150. LDL was roughly high 30s, and LDL cholesterol was 80s. Now, I want to share with you, at this time, several angiograms, and these angiograms were all reviewed in the Cleveland Clinic Angiography Core Laboratory, which means that I can tell you with confidence what is the degree of the change. What you're seeing here is in a retired pediatrician, the left anterior descending coronary artery, and from the arrow on the left to the arrow on the right was found to be a 10% improvement. So this is about as well as you can see with the naked eye. It's a little easier in this 58-year-old factory worker. You're looking at the circumflex artery here, and from the arrow on the left to the arrow on the right was described as a 30, let's try it again. That was described as a 20% improvement in the artery. On this third one, this was a 54-year-old security guard. You're looking at the right coronary artery, and from the arrow on the left to the arrow on the right was described as a 30% improvement. Now, this is a colleague of mine, Dr. Joseph Crow. In 1996, at age 44, he began getting chest pain. And he was not diabetic. He was not a smoker. He did not have a high cholesterol. He did not have high blood pressure. He had no strong family history. Chest pain. By October of 1996, cardiology got around to doing an evaluation and worked him up. They could find nothing wrong. A month later, he finished his surgical schedule and sat down to write post-operative orders when suddenly he got this elephant sitting on his chest, pain in his left jaw, shoulder, and arm. He was having a heart attack. He was whipped down to the catheterization lab. They start the catheterization. He had a cardiac arrest. They resuscitated him, finished the catheterization after 2 more cardiac arrests. And he was then discharged from the hospital about a week later when he had stabilized. And my wife and I then asked Joe and his wife out for dinner. Joe, come on. You've been eating this absolutely terrible Western diet. You've got the typical Western disease. We've got 10 years of data on plant-based nutrition. Why don't you give it a try? He said, okay, yes, I'll give it a shot, because they couldn't seem to do anything else for me. And the reason he was so depressed was at the time of his catheterization, the entire lower 1/3 of his left anterior descending coronary artery was all moth-eaten and diseased. Well, he became the absolute personification of commitment to whole food plant-based nutrition. And over the next 2.5 years, his cholesterol, his LDL plummeted by 30%. And after 2.5 years, he then had another angiogram. Now, up in our surgical office areas, our doors were several apart. And I found myself at noontime on the day during which, in the morning, I knew he had had a follow-up angiogram. I walked over and let myself into his office. There he was, sitting behind his desk. Joe, I understand you had the follow-up angiogram today. Mind sharing with me? How did it go? So he came around his desk, put his arms around me and said, I think we're doing okay. So I said, well, would there be any chance that perhaps I could see the follow-up angiogram? And as you can see here, when you compare his original on the left, all of the disease has seemed to be absolutely eradicated. And it's interesting that when the patient is young, and especially when the plaque is young and made up of inflammation, fat, and cholesterol, the body can do an incredible job when you follow this program 100%. A little tougher when you've got an old plaque that may be there for decades, made up of scar and fibrosis and calcification. But even those patients, even those patients are going to greatly benefit. And I can show you how that works later on here in just a few minutes. Here's another gentleman from Florida, age 45, who had a heart attack in July of 14th, 2017. And you can see where the arrow is pointing. This is a branch of his obtuse marginal artery from to the back of the heart. This was described as an 80% blockage. And because of several other blockages, his cardiologist was anxious that he should have bypass surgery. But the patient said, no, I read this book, Prevent and Reverse Heart Disease. I'm going to try to do it with diet. And the doctor said, no, that won't work. So a year later, he did another angiogram. And sure enough, what was originally 80% blockage was now, at the arrow, you can see 40% blockages. Well, at this point, he happened to switch cardiologists, and his new cardiologist, after another year and a half, wanted to get a follow-up, and sure enough, it was all gone. Now, this really raises an interesting point. Here you have a disease which is terribly serious, so serious that every 34 seconds, somebody's dying of heart disease in this country. And here you would go right ahead with plant-based nutrition. No enormous expense, you got to eat. And look what happens. The disease begins to disappear. Why isn't it really almost mandatory that every patient with heart disease at least be told of the option of plant-based nutrition? Now, it's interesting, going back to that original study, when we summarized over 12 years, the 18 patients who stayed with us for the full 12 years, I wanted to know how many coronary events of worsening disease they had experienced in the 8 years prior to coming into our study, while they were managed with expert cardiologists. And as you can see here, those 18 patients during the 8 years prior to coming into our study had 49 coronary events of worsening disease. However, once they came into our study over the next 12 years, 17 of those 18 patients had no further events. There was one little sheep who wandered from the flock, got into the lamb chops and the Western diet, and sure enough, had an event. But now I'm happy to say he's back with the flock. So I was very excited and very obviously pleased with the results, because we showed that indeed not only could we halt this disease, but we could actually get some ways of reversal. But not everybody was excited about it. Some people said, well, Dr. Esselstyn, wait a minute, that's a pretty small study. What makes you think you could ever do that with a larger group? Well, so we did. And we had 200 patients in it. 2 were lost to follow-up. That left 198. Of the 198, there were 177 over close to 4 years who followed our program. That was actually 89.3, almost 90%. The 21 patients who failed to stay with the program had disease progression, which was actually still 62% had disease progression. That is, those who didn't adhere. In other words, of those who were adherent, one patient who misbehaved while he was on vacation in China ate off the economy, all the wrong foods, had a small stroke. And actually, he should not even be in that group because when you think about it, everybody who followed the program for that time period of close to 4 years was free of disease progression. Again, those 21 patients who were non-adherent, 62% had disease progression. Now, I thought it would be interesting to compare our results with some of the really better known results in Western science. So if we start here on the right, in that box, you can see 25% of the people in the Lyon diet heart study, 25% had disease progression, that is to say, heart attack, stroke, or death in 4 years. Now, if we go to the left of that, the natural history of coronary disease from Columbia Presbyterian Hospital in New York City, 20% at 4 years had a major event, heart attack, stroke, and death. Then we go on further to the Courage study by Bill Bowden, and you can see that at the end of 4 years, 19%. Now, if we go to the left, there we are. We put in that one patient who had eaten off the economy while on vacation in China, 0.6%. Why is there such a glaring difference? This, quite simply, is because we were teaching the patients about causation. And if you are going to get patients to follow a lifestyle change, it is imperative that you show the patient respect. The only way that I know to show a patient respect is to give them our time. And at the present time, in our format, patients attend our single-day cardiovascular seminar, which lasts for really usually about 5 to 5.5 hours. And a little bit old-fashioned, and I personally insist on having the phone call of all the patients. And 2 weeks before the seminar, I always will call every one of the patients who are attending so that I can get my arms around their story. And also at the same time, give them an opportunity to ask questions of me so that coming to the seminar, we have a strong platform from which we can all move forward. So comparing the diet to the interventions of the interventions of stents and bypasses, there is no mortality with the diet. There's no morbidity with the diet. There's no added expense you've got to eat, and the benefits improve with time. And what is so exciting for these patients, you usually are wondering when, if they've had a heart attack, when is the other heart attack going to come? They are empowered by the knowledge that they themselves are now in control of their disease, and they absolutely can make themselves heart attack proof. Now, this is sort of an interesting patient. On the left, what you're looking at is on the ankle. This is a pulse volume. This was in a 54-year-old gentleman with heart disease who also had a partially blocked artery in his thigh. And when he came to see me in the office, he had to stop 5 times while crossing the skyway because of pain in his calf muscle because of the partially blocked artery in his thigh. But I was so focused on his heart that I sort of forgot a little bit about his leg until after being with us for about 10 months, one day he said to me, "Dr. Esselstyn, do you recall when I started seeing you, I had to stop 5 times while crossing the skyway to your office?" "Yeah." He said, "You know, in the last month, it got to be less and now it's gone." I said, "Well, Don, then back you go to the vascular lab." And now you can see, compared to the graph on the left, on the right, it has absolutely doubled. And what we now had, within 15 months of starting our program, we had absolutely rock solid scientific proof that food and food alone could absolutely stop any disease progression and get disease reversal. Now, somebody's going to say, well, wait a minute. What about those statin drugs? Weren't they there? No. Just look at the date, 1986. There were no statin drugs at that time. Here's another gentleman. This is a 78-year-old retired high school chemistry teacher. And in his retirement, he and his wife they enjoyed entering square dance contests. But it was during the fast square dance that he was getting bilateral pain in each calf muscle. So when he saw these vascular surgeons, he was not very excited about the large operation that they were describing for him. And when he came to see us, we talked about this, and he said, Dr. Esselstyn, if I choose your method, how long will it take me to get rid of that pain in my calf? And I looked at him with great wisdom in my face and said, probably about 10 or 11 months. 3 months later, I got a phone call. Dr. Esselstyn, you do not speak the truth. The pain is gone. Now, we all know that the diameter of the artery to the heart is a lot greater than the artery to the penis. And yet, not infrequently, one of the first signs that patients will have that they have vascular disease is when they are no longer able to raise the flag. However, all is not lost. Not infrequently, 10 or 11 months after I've counseled somebody, I'll get a phone call. Dr. Esselstyn, yes, this is Mr. So-and-so. Yeah, good to hear your voice. Yeah, Doc, I really thought I ought to give you a call because recently something has come up and I'm wondering if I don't owe you another check. Now, here is a slide which shows a phenomenon in medicine for evaluating heart circulation called a PET scan. I want us to focus on the left, and you will see that if the blood supply to the heart muscle is orange or yellow, that's okay. But you can see on the figure on the left, on the right-hand side of that figure, there is a patch of green. That is ischemia, the word that says that portion of heart muscle is not getting its due supply of nutrient and oxygen. So I counseled him in that day. I counseled him, and sure enough, he was a good patient. And 3 weeks later, when we repeated the PET scan, the area that previously had been ischemic now was getting blood supply. And I first saw this, I thought, wait a minute. In 3 weeks, we haven't gotten rid of that blockage. There must be something else going on. So we looked, here is a heart where you can see contrast has been introduced into not only the major blood vessel, but even it get carried on into the smaller vessels, which are intramuscular. And I went down to the main campus after I saw this and asked Rodriguez, who is a director of the Cleveland Clinic cardiovascular pathology, who does about 200 autopsies a year. And I asked Rod, I said, how often do you ever see any kind of plaque or blockages once the artery has dived into the heart muscle? His answer, never. Now that was really exciting because it gave me information about what was going on. For example, when we first see these patients come to us, they're eating terribly. Their endothelium now is really no longer doing the job. It has become almost your enemy. It is making two molecules of what we call vasoconstriction. In other words, the artery is getting pinched or smaller. Those molecules are called endothelin and thromboxane. So when we see these patients, all those small, tiny intramuscular arteries, although they do not have contained within themselves blockages or plaque, they are simply pinched and squeezed and narrow by virtue of the endothelium and thromboxane. And so the other thing that happens, obviously, is the endothelial cells are no longer making an adequate amount of nitric oxide. So after we have counseled these patients, they stop eating any foods that are going to injure the endothelial cell. They stop making the vasoconstrictors of endothelium and thromboxane, and they start making nitric oxide, the great vessel dilator. So the entire coronary artery tree begins to open up, which explains why they've restored the circulation. So, what are the 8 measures of cardiovascular disease that you can show reversal? We've shown reversal of the angiogram. You can get reversal of the stress test. We've shown reversal of the PET scan. The arteries going to the heart, the arteries going to the neck will reverse. We've seen it reverse in the ones to the leg. We've seen it reverse in the one to the intestine. We've seen it, the pulse volume reversed. I've shown you that. And the symptoms that reverse are angina, claudication of the calf, and erectile dysfunction. Now, for those of you who have never been to Cleveland, this is the A building where for many years, I worked on the 8th floor as a surgeon, but I also like to have you see what the trees look like in Cleveland in February. However, after I retired from surgery, I was rehired by the clinic because of my interest in nutrition and heart disease, and I worked at the Wellness Institute. Now, the Wellness Institute has a more modified budget, but the morale is really quite high. And if there's one thing I've learned since 64 years of being graduated from medical school, perhaps nothing is as important as, yes, while brains are important, nothing are as important perhaps as persistence, persistence, persistence. Best exemplified by this young damsel in Life magazine in 1939, trying to do the splits. Sure enough, the other day, in I think it was Peoria, Illinois, somebody spotted her, and she now had it right. And I thank you for your patience and your understanding.